Hello, my name is Anthony Bedard, and my persuasive speech today will be on over-medication in the U.S. I'd like to start off on the first slide with some statistics. And the first statistics that is the most glaring is that 70% of Americans are on some type of prescription medication. According to the Mayo Clinic, the top three offenders of those medications are antibiotics, antidepressants, and opioid painkillers. Now, if we look a little bit closer at that number, 70% of Americans, the population right now is 318 million people. That means that 190 million people are on some type of medication. Moving on to the next slide, we'll break that down a little bit further. Now, if we took all the prescriptions that were written in 2012 and spread that out across the entire population, right? That would equate to every citizen receiving a new prescription medication each month, 12 per year per person. That's how many prescription medications were given to patients in 2012. If we move on to the next slide, we'll take a look at the first of the three offenders, the first one being antibiotics. CNN gives an interesting example of that. So, of all the patients who went to emergency departments across the nation in 2012, 10% of them reported their chief complaint as a sore throat. 60% of the people who went in with a sore throat were prescribed antibiotics. More often than not, these antibiotics are prescribed before bacterial cultures can come back positive or negative. That means that people are getting a just in case. Doctors are trained to try to treat it as soon as possible, and antibiotics, broad strokes purposes, can't hurt you if you take them and don't need them. So they prescribe it as a just in case medication, which leads to another problem. Moving on to the next slide is superbugs. Superbugs are essentially bacteria, germs that over time adapt and become resistant to antibiotics. Some of the more common ones are MRSA, which is methicillin-resistant Staph aureus. C. difficile is another prime example, and I mean some of these you can get just from being in a hospital. So prescribing medications for bacterial infections that have become resistant to antibiotics is kind of a self-fulfilling problem, in that, I mean, we prescribe just-in-case medication, bacteria and germs become resistant to it and adapt over time, so then our medications no longer work on it. Now, 2 million people were affected by these superbugs last year. 23,000 deaths resulting from bacterial infections that are resistant to antibiotics, which some could argue is a result of the over-medication or the over-prescription of antibiotics. If we move on to the next slide, we'll take a look at our second most common prescription, and that is antidepressants. 68% of Americans are on an antidepressant medication. Half, 50% of those that are taking an antidepressant, that is their only form of treatment. Despite the fact that cognitive behavioral therapy is proven to be more successful in conjunction with medication, exercise and diet can have just as much an effect on a depressed person as medications can. It'd be even more successful if it's used in conjunction with medication. So that's another prime example of over-medication. 50% of that 68% of the population that's receiving antidepressant medication, 50% equates to 95 million people that is their only form of treatment for depression, is just medication. Moving on to the next slide, we address our third, and that is opioid painkillers. In 2012, 259 million painkiller prescriptions were written. The population of the U.S. at that time was 314 million. Again, if we do the same thing we did earlier and we break that down and we start handing out each one of those prescriptions to a person in America, that means that 84% of our population would have received an opiate-based painkiller in 2012. 84%. Now, of course, that's not correct. You have people who are in pain management, so they consistently receive these opiate-based pain medications. But still, that's still a startling number, that if we handed out one to every person relative to the ones that were written, that would mean that 84% of the population of the U.S. would have received some opioid-based painkiller. Moving on to the next slide, we want to discuss how this happened. One is it's trained. It's inherent and systemic. By systemic, I mean that doctors, physicians' assistants, nurses are taught that pain is subjective and it's the fifth vital sign. Now, according to Dr. Mark Rubenstein, he states that doctors are paid according to patient satisfaction. Now, if a patient is in pain, again, a subjective level of pain, the only way they're going to be happy is if the pain goes away. So doctors it's an incentive for them to prescribe opiate-based medications because it's guaranteed to stop the pain. Then they get a good patient satisfaction survey, like Press Ganey, for example, and doctors get paid, or it may be on their yearly or annual evaluation. So it's incentivized to provide pain-killing medication instead of understanding that a certain level of discomfort is okay. You don't need a quick fix with a pill. So moving on to the next slide. The medical community has attempted to fix some of these problems. The first they've done is e-prescribing, which is electronic medical forms. So doctors can go in and they can see if a patient is essentially what's referred to as doc shopping, meaning they're bouncing from doctor to doctor to doctor, saying the same symptoms, whatever it takes to get opiate-based pain medication. Now, I'm sure that I don't know what the statistics are as far as those that are reported to have abused the system, but this electronic medical forms or electronic medical records can help prevent that. Moving on to the next slide, we have to look at alternatives to drugs as a cultural change, not just a clinical systemic problem. Cognitive behavioral therapy is proven to work with or without medication being used at the same time. And of course, this is a reference to the antidepressants that I talked about earlier. Another one is exercise and diet. There needs to be a shift from curative medicine to preventative medicine. And parts of that need to be exercise and diet. And finally, we have it's okay to be uncomfortable. Pain is temporary. In rare cases, it's not. And there are pain management programs for those people. But for the vast majority of people requiring painkillers, it's a temporary problem. Pain will subside. It may last an hour, a day, a week, but it will go away. It's okay to be uncomfortable. Thank you all for listening, and at this point I would open up to any questions that I would have from my audience, and since I'm hearing none, I thank you very much for your time.